Every day in India, thousands of people get implants. Some lose a single tooth, others lose an entire row of teeth. People save money, go through surgery, endure pain, wait for 2 to 3 months for everything to heal, and are confident that their problem is solved for a long time. But after a year or a two, complications begin, and sometimes even a second surgery is needed. And all this happens because they weren't told the most important thing, that implants are not suitable for everyone. In this video, I will briefly explain when you should get an implant and in which cases it might not take. First, let's figure out what an implant is and what it consists of. Implant is called an artificial root which will support the future structure or our future tooth. As you can see in this figure, it is placed directly on the bone. For example, if the patient is missing a tooth, we can easily place an implant. Now, the after 2 or 3 months, or in rare cases 6 months, we place an special connector on it called an abutment, which is screwed directly into the implant we have installed. The future crown is placed directly into the abutment. This is what implantation is. Now the question arises, what do you absolutely need to know before getting dental implants? The first thing is, of course, the healing period. The healing after the implant is placed, we need to wait before making the tooth for 2 to 3 months, or in rare cases, up to 6 months. Now, the second question arises, as the implant healing takes 3 to 6 months, what determines the time frame? For the implant to hold well, means for the implant to get integrated with the bone well, which is also known as osseointegration. So, initially, when we screw in the implant, there is no such connection, yet the implant is held in place only by the threads which are present on the implant. And then later, the osteocytes, which are the small bone cells, begin to grow into the threads of the implants. They actually grow right into the threads. And then, thanks to this process, because of this, we achieve fixation. Then gradually these osteocytes, the bone cells, start to grow into the threaded connections. Another important thing to know before implantation is that, of course, you will have to go without a tooth for some time. So after the implant is placed, you will have to go without a tooth until it integrates. Now, another question that can come to your mind is, if you are missing your upper front tooth, the one in the middle, does that mean you will have to go to 2 or 3 months without a tooth? The answer is, there are different situations. Sometimes we place the implant and immediately put an on the abutment, and let's say the healing cap, and we can make you a temporary plastic tooth or a cover cap. That is possible. But sometimes we cannot immediately make a restoration on it. So in that case, we also have several options. Option number one is, you will have to go without a tooth. Second option number two, is the doctor tries to come up with something like a bridge, which is where we attach a kind of a bar to the neighboring teeth, and the doctor creates an artificial tooth right on the bar. You should be prepared for the fact that you really might have to go without the tooth for some time. You should also be prepared for the significant swelling if you decide to get an implant. It can be swelling of the mucous membrane, the visible soft tissue swelling, and of course, the intensity and severity of the swelling depend on various factors, both on the individual's body and on the specific nature of the procedure performed by the patient. The swelling reaches its peak on the third day, and after we have placed an implant, the swelling is at the maximum on the third day. But after that, it gradually subsides. The stronger the body reacts to the intervention, the better the healing is. We take an X-ray, and just after 6 months, there is already a huge amount of new bone growth. And now you also need to know, you also need to be prepared before the implantation procedure and before deciding on implantation for the possibility that the implant might not take. Now the question is, why might an implant be rejected? Well, actually, there are quite a few reasons for that. The first reason is the individual characteristics of the body. When it does not accept or does not tolerate the alloyed titanium itself or the small impurities that remain in the titanium. Even though modern titanium is now purified from additional metal impurities, which by the way used to be the factor in rejection. The second reason is, of course, an already existing comorbidities. At the end of this video, I'll tell you exactly which diseases make dental implantation impossible. If the implant is still rejected or fails to integrate or in simple terms fall out, in this case, of course, there is a specific protocol that must be followed. Either we send the implant directly to the company to carry out some test, or we re-implant it, check one more time, and we simply take it out, or we simply take it out, allow healing to take place for 6 months or so, and re-implant the new one. It can also be done on the same day too, depends on the condition. We observe again to see what has happened. Now I have told you what to prepare for before the dental implant procedure and what to expect. Now I will tell you about the less obvious advantages of the dental implants. For me, the main advantage of the implantation is, of course, the so-called preservation of the neighboring teeth. So, if we are talking about the kind of a clinical situation where one tooth is missing, in the past we would had to place a bridge or grind down the two neighboring teeth or replace the defect. But now, thanks to the implantation, we can simply place an implant or put on a crown, or our neighboring two neighboring teeth remain completely untouched, healthy, and will last for a very long time. That's why for me this one is the main advantage of the dental implant. The second advantage is the high and the predictable success rate, which is very high in terms of percentage. In fact, it's really between 98 and 99.8%. Can you imagine? Another advantage, of course, is comfort. If we compare removable dentures that the patient wears with implants, the difference is enormous. The difference is enormous. With implants, we can make a fixed or a non-removable structure. This means that the patient will be as comfortable as possible and won't have to worry about anything falling out. Thanks to this dental implants, we can stop the process of bone atrophy too, or the bone loss. When there is no load on this area or the bone can become softer, and indeed it starts to going down or recede. That's why when we place an implant, our bone starts to function, and in other words, it recognizes that there is a load on it and bone loss does not occur. The next point is the guarantee. What does that mean? For each implant, you are given a specific certificate with an individual identification number. There is extensive coverage worldwide, and you can always take that certificate with you and show it at any clinic in the world. Here I have the implant, here is a number, and you will be assisted for any kind of problem. Another advantage to add to the list is speed and durability. The process or the procedure of installing even a single implant like this takes it to most 20 minutes, and for the durability, of course, with proper care and regular checkups at least once in a year, ideally after 6 months, this implant will last you a lifetime. Now, who is definitely not a candidate for the implantation or the getting implants? First and foremost is diabetes, specifically uncontrolled diabetes. When the medications are no longer effective in controlling your blood sugar, if you have such uncontrolled diabetes, implantation is not suitable for you. The second complication or the contraindication is cancer. That is, if the patient is under the care of an oncologist, implantation is contraindicated. The next contraindication of implantation is patients who are taking so-called bisphosphonate medications. These medications are taken by the patients during the treatment of osteoporosis and also in the treatment of cancer. And another contraindication for implantation is immunodeficiency conditions or diseases such as AIDS. And the final contraindication is age under 18 years. It may seem completely unexpected for the patients who are under 18 years, and in exceptional cases, even up to 21 years, implants are contraindicated. This is because the formation of the final development of the dental or the jaw system is still going on at that age. Be sure to tell your family and the loved ones about these contraindications. Share this video so that as few people as possible make mistakes when getting in implants, and I would be very grateful to you. Give this video a like if it helped you learn more about implants and make the right choice. Subscribe so you don't lose this video. Take care of yourself and your loved ones. Thank you.